Okay, how to treat Achilles pain. It's going to be a two-part video series. The first part, we're just going to talk about the actual manual work, and then the second part's going to be more of the restorative and recovery work. So what you're going to need for tools, some sort of trigger point. You could use a lacrosse ball, some sort of scraper. You could use any gua sha tool for the face. These are like, I'll be sending links. This is like a $12 actual tool, and then some sort of cream for lubrication. Now, I would recommend using arnica for this. However, I am using today a NSAID anti-inflammatory, which you can use after, okay? Or if you don't even have that, use Vaseline. So, step one, the first thing we want to do, all right, is again the manual work. So, I'm going to take whatever the foot, if it's this, my right Achilles, I'm going to take my foot, and the first thing I want to do is start to restore some mobility into the plantar fascia and the toe. So I'm going to take a little bit of, Vaseline, arnica, whatever, and I'm going to push with my thumbs from the calcaneus bone, so this bone here, I'm going to push away towards my big toe. Okay, so I'm going to just start to work, and you're going to feel all sorts of great. You want to set the timer for 2 minutes and start to work this section right here, which is the middle of the foot, and from the big toe to the inside heel. So about half that foot you're going to work through. But we really want to focus on the middle. You can even push on and feel that for 2 minutes. Okay? After that, we work our way right up to this big toe. What I'm going to do is I'm going to clamp down underneath the toe knuckle, and I'm going to start to push and pull as far as I can. Sometimes I even take my finger like this, and what I want to start doing is pull it out of its joint. Pull the big toe out of its joint 20 times. Pull out of its joint, and then what you're going to do is start moving the top part of the toe. Bend that 20 times. This little part from this toe, from this little thing up. And what you can even do is take your thumb in that dent, put it in there, and just start to push and pull that guy 20 times. Then again, the full thing all the way down and all the way up for 20. Just start restoring and really get in there and start to bend that toe and restore some mobility. Right around there is going to start to feel a little bit better. Now, step two, we get into the trigger points. So there's 3 main trigger points. One's going to be on the inside. Okay, so what you're going to do is find this nubby bone behind it. Okay, you're going to just start going using anything you want. Okay, I usually use a lacrosse ball. I'm just going to use something that you can get a little grease so you can kind of glide a little bit. What you're going to do is find a tender spot, and you're going to just sink on it, and you're going to push and pull the bottom foot gently. Okay, another way you can do this, you can kill 2 birds at 1 stone. You can take your thumb and find a spot, but again, that can be annoying after a while, so you just want to camp in on that. So you can put, if you've got one of these AccuMobility balls, you can usually find it. It's usually on the same side, okay, which means it's usually, if this part of my calf is sore, usually the opposite is really sore too. So you can kill 2 of the trigger points at once by laying it down on the outside. So it's in the outside. If I take the outside of the malleolus bone, right behind us, so again, this is the front part of the shin, this tibialis anterior. We're looking at the sides here. Okay, we're going to find a spot. Okay, even if you have another lacrosse ball, and you can, again, 2 minutes up and down. But just try to sit and breathe. Okay, often we just try to do too much, so maybe just camp out for 2 minutes here. Again, 2 minutes on the other side. And the third one is somewhere up in the calf. So the Achilles runs about underneath the gastroc to here, so somewhere in that gastroc is going to be tender. That you're going to just sit and lay on. Again, about 2 minutes. Okay, so we have manual work on the bottom of the foot, the toe, okay, and then the trigger points. Now, we want to get into the final part before we go into part 2 is the scraping. Okay, so you're going to use your gua sha tool, and what we're going to do is find the back here. We're going to start to scrape upwards with about a 45-degree angle, even pressure, all the way around that ankle. Okay, but you're probably going to get the most from this bone up. This stuff in here is going to be gross. Just going to let you know that if you have an angle, if you can get in there, like this thing has a little nub, I can like really get in there. If you can see at this little tool here, I can really get in those grooves. Okay? Again, we don't want to rub back and forth and being terrible. You just scrape up, and eventually, see how this is getting pink right away? When it gets really pink, you want to stop. Everybody's like, when should I stop? If you need a time, it's 2 minutes, but the uglier it is, the more damage it is. Like my ankle's pretty busted up and it's getting red right away, so I'm going to stop. Okay, but even if it hurts, try to get at least 50 gentle passes. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Go as gentle as you need to, because what we're doing is getting some blood flow in there. Okay, now I would also recommend scraping the bottom of the foot. Again, take some, you can take Vaseline, you can take Arnica. I mix those actually two together and just use that. And again, 45 degrees, I use 2 hands. If you're using a washout tool, 2 hands, scrape that stuff down. Okay, especially the outside edges, that can get really gnarly. And then back to the inside. This one, I like to go for just 2 minutes straight. So again, the whole entire thing should take you 12 minutes, and you want to do this every other day. Part 2.